sige. So if you want to interrupt me, I'm okay with that. But I think there's a session for Q&A also. So if I'm going too fast or I'm rambling, please call my attention. Kasi minsan pag na-excite ako, I talk really fast. Okay. So by the end of this session, everyone is expected to, the participant is expected to conduct a first clinic visit with an HIV positive patient, and then hopefully be able to address yung mga commonly asked questions nila during the first visit. We saw a while ago, there was a poll on the commonly asked questions also. And then very important is you have to be able to identify the needed diagnostic workup in the first clinic visit of an HIV positive patient. And then you should have the confidence in starting antiretroviral therapy because this is one of the core integral part of the first visit. Ideally, we should start the antiretroviral therapy as soon as possible. And I'll be mentioning that a lot in this discussion. All right, so for the part one, by the end of 2030, the goal of WHO is getting to zero. And I'm sure you've heard of this. No? Pag sinabi natin getting to zero by 2030, zero new HIV infections, zero discrimination, and zero AIDS-related deaths. Malapit na ba tayo dyan? Yung Pilipinas. Hopefully. But in order to get to that, it's important to really start treatment right away. So when the patient goes to you, kakadiagnose lang niya ng HIV, you start medical care and treatment as soon as possible because the ultimate goal para marating yung U equals U. So that means undetectable, ibig sabihin, their viral load is suppressed. And if the viral load is suppressed, that means untransmissible. So you make the patient healthy and you can protect others also from acquiring the disease. So that's our ultimate goal for getting to zero. We need to achieve U equals U. Okay. So again, you want to start antiretroviral therapy as soon as possible. So when you catch the patient, if you feel like that this patient is ready, and we'll be discussing in the succeeding slides, ano ba yung mga conditions na hindi dapat muna mag-ARV or ART, or handa na ba yung patient, pwede na ba umpisahan. So doon papasok yung starting antiretroviral therapy as soon as possible. So I just want to show you these landmark trials, so yung START tsaka Temprano trial. When I was a resident, naabutan ko pa yun na not all HIV patients would be started on ART or treatment right away. Parang nung time na yun, they would wait for the CD4 count to go below 200 before they are offered treatment. And then comes itong mga trial na to, yung START tsaka Temprano. So they basically look at may benefit ba na mag-umpisa ng antiretroviral treatment for patients even if their CD4 count is still high. So basically regardless of CD4 count. So yung STAR trial, it was so convincing that they had to stop the trial somewhere in the middle because they showed that there's a big difference in terms of morbidity and mortality if you start antiretroviral therapy early compared to waiting. Kasi noong time na yan, yun yung practice. So if we look at this graph, no, the blue line represents yung mga patients, Philippine living with HIV, who deferred initiation to treatment. And the red line represents those patients who had immediate initiation upon diagnosis. And by eyeballing, you can see malayo yung difference, no? The time to the first primary event, malayo, mas mataas talaga dun sa mga nag-defer ng initiation. The same is true with serious AIDS-related event, serious non-AIDS-related event, and death from any cause. So they are all higher for those who deferred initiation. So the bottom line here is you want to start antiretroviral therapy right away as soon as possible. Okay. So this one is a manuscript that was published in 2021, and then they compared and they reviewed if there is really evidence regarding rapid or immediate initiation of antiretroviral therapy. So just to clarify some terms, pag sinabi natin rapid, it means within days or weeks of the diagnosis. Ideally, within 2 weeks, ma-start mo na. And then, immediate start, meaning dun sa araw ng diagnosis. So the manuscript was able to establish na yung mga pasyente who had rapid initiation and those who had immediate initiation, ibig sabihin within 2 weeks or at the time of the consult, achieve virologic suppression faster. So pag sinabi natin virologic suppression, that's less than 50 copies per ml. No? Not necessarily i-report undetectable. Basta less than 50 copies per ml, that's virologic suppression already. And also, they found out that patients on same-day antiretroviral therapy had improved retention to care. So this is important. You're able to start treatment and then you're able to link your patient dun sa cycle of care because we don't want them lost. Diba? Some patients kasi mauumpisahan, hindi babalik, and then babalik malala na. So we want them in the loop, consistently in the loop of the cycle of care. So basically, the takeaway of the previous slide, simple lang. Getting to zero involves starting antiretrovirals as soon as possible to achieve virologic suppression. And when you achieve that, U equals U, meaning virologic suppression, undetectable sila, therefore they cannot transmit it. Okay? So undetectable equals untransmissible. But moving on dun sa second part, no, malapit na tayo pumunta sa second part. Before you achieve this, when you catch a patient, you have to be able to establish a relationship of trust and respect. So ito talaga yung structure ng first medical visit. The patient is reaching out to you. The patient made the initiative na magpunta sa'yo, magpatingin, seek for help. So that's a win already na nagpunta yung pasyente. Your goal is to gain the trust of this patient. No? So this is a very common slide. I think this was also presented previously. In different stages of HIV infection in relation to the CD4 count, that's the blue y-axis in the left, and the viral load, that's the red y-axis on the right. And you can see below, dun sa x-axis, yung weeks and years, that's the timeline. When you get patients, you will get them anytime in this continuum. But if you notice, mahaba yung clinical latency. So that's usually you can get patients around this time. And of course, they will come in pag meron na silang mga nararamdaman or opportunistic infection. A while ago in the poll, pinakita ni Rad, merong mga sumagot na ano ba ang HIV? So sinasabi nila nanghihina, namamayat. So malamang if they have those symptoms already, they're already in the latter part of this continuum. So they have symptoms, meron na silang opportunistic disease. So this is the pain scale category. Sometimes I like putting them together, parang analogy yun na it would depend on where they are, dun sa stage na makukuha nyo sila, with how they're feeling, and it would affect how you're going to approach them. So it's not a cookie-cutter approach na pare-pareha sa lahat. You have to tailor how you deal with these patients because they will be coming in at different stages of the disease. And remember, at baseline, aside from iba-ibang stages of disease na sila dadating, at baseline, these patients coming in already have baseline different personalities. Hindi naman pare-parehas yung tao. There are some patients who come in, nakapag-research na sa Google, dami ng alam. There are some patients coming in na takot. They want help pero ayaw magsalita. There are some patients coming in parang galit, no? Parang inaaway ka. Kahit wala ka namang ginawa. Some are just really positive and happy. Parang they want to move forward. Yung iba naman business-like. So iba-iba. Iba-iba yung patients na you'll encounter, and the point is you have to be fluid. So the takeaway, no two patients are alike. Your consult has to be bespoke. Ibig sabihin, it's personalized. No? We will give you a guide on how to go about it. Pero hindi mo siya pwedeng gawin na parang checklist sa same patient about isa. Sometimes what you can do with one patient on the first visit, you can't do with the next patient. So you have to be able to be fluid and adapt to your patient. So punta na tayo dun sa actual consult. So you have to set the scene. Para siyang movie, or you make a very conducive environment. So ideally, mas maganda if the environment is relaxing, or there's privacy. The patient can feel that he can talk and he can feel secure to divulge things to you. And then when the patient comes in, you introduce yourself and ask how the patient would want to be called. So sometimes they would, like in our clinic, no, or from the hospital where I come from, if they're admitted, first time ko silang mamimit, there's a blue chart that I can look at. Makikita ko na yung baseline nila, demographics. This patient, this is his religion, ito yung occupation na. So you'd have an idea how to approach the patient. And then, minsan mahaba yung name. So you ask them, how do you want me to address you? Anong gusto mong tawag ko sa'yo? So that's going to help put them at ease. Be prepared for questions also. And then it would be nice if you already have visual aids. So that's very, very helpful. Even in class, it helps when there are visual aids when you talk to your patient. So you can keep that handy beside you. And zero judgment, please. No? So talagang have an open mind. Dapat pag nag-start ka ng clinic mo, nakakain ka na, hindi ka pagod, hindi ka galit. Because it will reflect on the way you handle your patient. So you yourself, you have to be at ease to put your patient at ease. And then during the meeting, you can set the goals and expectations. So pag-uusapan nyo and what the patient has to expect. Okay. Then let's go to effective communication. Ano ba yung effective communication? What does it entail? Because I'm sure we all know ano ba yung communication. So it means actively listening and attending to the patient. So you have to make the patient feel heard, and you have to take your time. Huwag yung parang minabadali niyo yung meeting niyo, or kasi kailangan ma-tick niyo yung checklist. You have to take your time because these patients are coming in, most of them are scared, no? And they obviously came to you because they need your help. So you have to be able to demonstrate a caring and respectful attitude. You encourage the patient, no? Pwede niyo silang i-compliment or comment na, pwede niyo sabihin na, yung pagpunta mo pala ngayon, that's already the first step for you to get better. It's already one foot in the door kasi nagpunta siya sa'yo. So things like that you can say to encourage them. And of course, you have to speak at the level the patient can understand. Kailangan malinaw, kailangan simple. If you feel like your patient can't adjust with the way you talk, try to have a feel. Paano nyo mas mapapaintindi sa kanya? Kung kailangan gumamit ng analogy, pwede. Kung kailangan gumamit ng mga celebrities na meron ganitong sakit din, pwede. The point is, you have to be able to reach your patient, to make your patient understand. Tapos every now and then, you encourage the patient to ask questions. So then we go to building rapport. Kanina, I think in the poll, one of the hardest things for you guys is building rapport. Hirap naman talaga, especially doing that in the first visit. No? Ang daming kailangan pag-usapan. Yeah. So for the steps in building rapport, paano ba magkaka-rapport? Meron bang instructions talagang rapport? So these are just guides, no? So paulit-ulit, you show interest, respect, you show support and care, and try to read your patient sa may verbal and non-verbal cues. And then pagka kunwari pawis na sa patient, or parang very uneasy, or parang ayaw na niya magsalita, you have to be able to respond immediately to this cue. So you can stop, you can pause, you can say, gusto mo muna bang magpahinga tayo, or do you want to rest a bit? You try to read what the patient is telling you. Or minsan, some patients would come in, I've experienced that. They want to seek my help for their HIV, but they don't want their companion to know, kasama yung mommy. So, pagka parang gumagano-gano na yung eyes ng patient, so parang you have to find a way na excuse si mommy, or labas mo na si mommy, things like that, no? So they're going to give you cues. Yun. Also, you have to be able to balance intimate and professional relationships. So this one is very important kasi you feel like you want to be close to that patient or you want to gain that patient's trust. But at the same time, you have to draw a line between being too familiar or intimate with the patient and you being the professional. So don't cross that border. There's still this thin line between you and the patient to maintain a professional relationship. Siguro later on in the succeeding visits, if talagang there's a form of friendship forming between you and the patient, maybe that's okay. But my suggestion is just to not cross this line because there should always be a professional relationship between the two of you. So we mentioned about flexibility a while ago, and again, respect the patient's autonomy. Ibig sabihin, that patient is able to decide and think for himself. So hindi natin pwedeng, you can't force that patient, hindi mo pwedeng ipilit kung ano yung gusto mo sa patient. Show confidence and show non-judgmental attitude. Paulit-ulit kanina, no? So bawal ang judging. And then reassure the patient about confidentiality. And one trick also is, as for building rapport, is building rapport with the family. So some patients have very good social support. So you can offer your patient na, kunwari, ano pa, Max, may kasama ka ba sa labas? Gusto mo ba silang papasukin? Or gusto mo bang kausapin ko din sila? Some patients would want to tell their family but they don't know how. So yung style ko, I ask them sometimes, no, pagka ganun yung situation, do you want me to talk to your family na kasama ka? We'll tell them together, then they can come with you during the next clinic visit. Pwede yun. So in that way, you will be able to establish a relationship, not just with the patient, but with the support system of the patient. So when you're communicating with the patient, there are different components. There's the verbal, it's what you say, or the content of what you say, or the choice of words na ginagamit ko. But there's also non-verbal cues. So yun yung body language, no? Pwedeng text and text yung patient, or para siya nagmamadali, or naiilang. Those are the non-verbal cues. And the paraverbal, this one is interesting, is the tone of how you say it. So for example, there's a difference when you say sorry, or versus when you say sorry. So it's the tone of how you say things. Yun yung paraverbal cues. So these three would interact to form a good communication method. Okay. So the point is, when you first meet the patient, you have to really care. Kasi I think it will flow naturally if you care for what you do and you care for that patient. Because sabi nga ni Theodore Roosevelt, people don't care how much you know until they know how much you care. Yan babalik sa'yo pag nakita niya wala kang pakialam. But if the patient who's reaching out for a lifeline feels that you can help him or you care for him, then you won that battle of getting over that hump. So you can start building the rapport and hindi mawawala yung patient mo sa linkage to care. So these are just some of the frequently asked questions during the first visit with an HIV care provider. So if this is your first time or hindi pa kayo matagal dun sa clinic nyo or sa hub nyo, it's good to Google some frequently asked questions, and dami online, and then they can provide you answers so that when your patients come in, you're prepared. Kasi if you can't answer their questions, they'll sort of lose confidence sa inyo. Parang, alam ba nito yung ginagawa niya? So be prepared to answer their questions. And kanina, interesting sa poll, no? Talagang sa atin very common yung, mabubuhay pa po ba ako or mamamatay na po ba ako? Hanggang kailan na lang po ba ako sa mundong to? Yun talaga, never fails, regardless kung anong klaseng patient siya, forever na tanong ng Pilipino, mamamatay na po ba ako or mabubuhay pa ako? And true enough, sa poll kanina, I think it was number 1. And then, mabawal ba kainin? Makakatulong po ba mag-vitamins? Kailangan ko po mag-work from home? these are my personal experience that I'm sharing with you. Tapos kanina nga sa poll, yung mga question nila is paano sasabihin sa pamilya, may gamot po ba? So I think yung paano sasabihin sa pamilya, I made a suggestion a while ago. You can help actually. You can help the patient disclose to their family if you're comfortable doing it. So for yung tanong na mamamatay na po ba ako or gano'n po ba ako katagal mabubuhay? Ano nga ba ang life expectancy for people living with HIV? So the key point is, key points, if you give them right treatment and care, they can live a normal lifespan. Or people who have good response to HIV treatment have excellent long-term. With the right treatment and care, yung sa life expectancy, people with HIV can live a normal lifespan, and if those who have good response to treatment can have excellent long-term prospects. And then you can, kahit naman sino, you can increase your life expectancy by not smoking and having a healthy lifestyle. Ay, naka-off pala ang aking video. There. So if you can see from this graph, a person living with HIV compared to a person with no HIV or who do not have HIV, that's the blue one, can approximate the same lifespan in the era of highly active antiretroviral therapy. So basta naka-treatment yung patient, yung good follow-up to care, we can expect that they will approximate the life of a person who does not have HIV. So this is abstract pa lang, no? March 2022. The whole article is not yet published, but basically, what it's saying is that life expectancy are estimated to be close to those of the general population, regardless of when they started ART. Previously, there were studies that were showing that if you start your antiretrovirals earlier at a high CD4 count, mas mahaba yung buhay. But this one, they're saying that it doesn't matter when you start the antiretroviral therapy. Okay. So part 2. So ito na yung actual clinic visit ng patient. So there's an element, pero may checklist. So kung makakalimutan nyo sa dami na pag-uusapan, you can have a cheat sheet beside you or parang nandun sa chart nyo, no? You can tick that you've already nadaanan nyo na. And like what I mentioned a while ago, minsan it's really impossible to cover everything during the first visit kasi ang daming pag-uusapan. Sometimes iiyak ka pa sila, iiyakan ka pa nila. So that parang yun pa lang 10 minutes na kayo. So you can't ask everything. So yung suggestion ko, if you have their chart or yun na may parang tick boxes, parang just mark the information that you would need to ask when they come back to you, para makompleto nyo. So it's very important. So chief complaint, ba't sila nandun, history, sa past medical history, very important you get the vaccination history. Hindi lang yung COVID-19 vaccination history, but also the allergy history. You review their medications because you will have to check some drug interaction later on. So it's important to have a list of that medications, yung mga tinitake nila, kung may supplements ba sila, o nag-glutathione ba sila, at kung ano pang ibang tinitake nila. And this review of medications, hindi ko lang to ginagawa sa first visit personally. No? I always ask every time I see them, or interval, parang just to check if we're missing out on something. Ayan, naulit yung vaccination history. Also, when you get the sexual history, I think sa poll kanina, a lot of people are having a hard time getting the sexual history. I think it has largely to do with our culture. No? We're very mahiyain or taboo to sa madala sa atin. Especially, I've noticed yung mga mas galing in the rural area, mas mas reserved when it comes to this. No? So when you get the sexual history, try to be really professional about it. Don't show any bias and ask them kung tinanong yung gender preference or use gender neutral terms. Pwedeng sabi mo number of partner kasi hindi mo ina-assume, you're not assuming na yung partner niya female, you're not assuming na yung partner niya male. So you can just use the word partner. And then you get the marital status, STDs, and STIs. So minsan you can segue also pag mukhang ilang na ilang yung patient. You can say, this might, I'm sorry, I really need to ask about your sexual history because this is part of what we need to know to help you better. Things like that. So try to be ikaw, when you're the one asking, dapat hindi ka naiilang. Kasi pag ikaw yung naiilang, may ilang din siya. But when the patient sees that you're okay with it, it's just part of the checklist, it's a professional thing that you're asking, then they'll be able to give you the sexual history. In the personal social history, I think it's important to establish also yung living conditions ng patient, exposure, travel history, may pets ba siya, may hobbies ba siya, malakas ba siya uminom, naninigarilyo ba siya, what does he like to eat, ano yung current employment status niya and yung occupational history niya, and then saan siya kumukuha kaya ng social and financial support. And you can ask also, if you get a lot of BPO patients also, or yung mga, kasi yung may mga health card usually, you ask ano yung HMO, and the reason why I'm emphasizing on this, a lot of them would want to use their HMO. But a lot of the HMOs, although there's a rule on it already, they make you sign para may clause doon na anything that's related to HIV or STDs hindi nako-cover. So some patients, ang gusto nila, their laboratories are covered by the HMO and there's a way to do that. Pero yung mga laboratories that's related to the HIV itself, like CD4, viral load, you can tell the patient na you might have to do this out of pocket. So you try to figure out kung kaya during the first visit, kung may HMO ba siya, yun, paano natin gagawin yung yung social and financial support niya. And of course, yung family history, very important. So if you look at the INSA guidelines, there's a very, very detailed list, no? Parang assessment tool that you can go over. You can download this online on what you need to ask regarding sa history ng present illness or taking the history of the patient. But I broke it down to 3 parts. So history of present illness, bakit nandun, yung question nyo is how it led to the diagnosis. So papasok dito, you can be able to assess the patient's level of knowledge on the HIV treatment and the need for assistance. And then pag pumasok ng HIV specific history, sometimes you get patients na diagnosed na sila matagal na, but they didn't decide to seek for care. So you can ask things about that, approximate date of the diagnosis, or may ERV na ba sila before, or ano yung naaalala niyang CD4 count niya. So that can count as a first clinic visit also. And then for people who are injecting drugs, so you can ask about yung drug practices nila, saan ba kinukuha yung needle nila, things like that. So sa review of systems, the way I like to do this also is thinking head to toe para wag kang wala kang ma-miss, no? Right? Head, so you ask about anything urologic. Pero ba siyang, do you have headaches? Do you get dizziness? Do you get doubling of vision? Tapos ipasok mo na dun yung cycle, signs of depression, do you get anxious? So sa depression, meron tayong checklist dyan that you can use, a scoring system. And then, while talking to the patient also, pwedeng nag-PPE ka na habang kausap ng patient mo or nag-eyeballing ka na. You can look at the skin habang kausap mo siya. So, you can ask about, may masakit ba pag umiihi? So, you go down from head to toe. So, inuubo ka ba? You have chest pains? As you go to the GI, how's your bowel movements? How's your appetite? So, head to toe. So, sa physical examination, I think it's very important, and not just for HIV patients, to have an informed approach to it. So, hindi siya basta-basta na, okay, nandito ka, mag-PE na tayo, yun na yun. You have to be careful because these patients are coming in already feeling vulnerable, and most of them would be scared. So, you have to have a trauma-informed approach to the physical examination. So, you will use language and maneuvers that communicates respect and that will provide a sense of safety and autonomy to the patient. No? Because they have to be able to trust you. So when you do your physical examination, be polite and professional about it. You can tell them that this is the standard nature of the examination and this is how it's going to happen. Even before you start, you can give them an idea of what's going to happen. Kasi ba, most of us are scared of the unknown. So when you know what's going to happen, pag meron kang idea on it, it will put you at ease, no? Because you know what to expect. And again, ask permission before proceeding. So minsan nga you have to ask it again and again. Parang, okay, I'm going to do this. Is it okay if I do that? Ganun. Provide instructions that are easy to understand. So dapat madaling maintindihan talaga and use professional language. No? Minsan magkaiba yung sinabi mo, I will now inspect the penis versus I want to look at your penis. Diba? Magkaiba eh. Pag kasi I want, parang masyado na siyang, parang invasive yung dating. So, I also utilize appropriate nonverbal skills. So, respect the personal space. Pag mukhang ayaw madikitan masyado ng patient mo, then respect that. Then always stay within the eyesight of the patient. So, kunwari may kakunin mo you're gonna get your stethoscope. Sandali lang ha, kukunin ko lang yung stethoscope ko. But it's within the clinic space. Tapos, avoid the phrase, this is nice, avoid the phrase, for me, or any language with sexual connotation. So, yung maganda yung example dito, okay, we'll now go to the bed versus we will now go to the exam table. So, mas professional pakinggan yung exam table. So, sa Tagalog lang, parang kama no? Kama versus examination bed. Pwede mo na lang sabihin ganun siguro. And remain mindful of draping. Provide modesty and comfort. So it would be nice if you have some form of covering or blanket for the patient. Kasi in psychology, a patient feels more secure pag naka-blanket siya or may naka-drape sa kanya. So if you're just going to examine the belly of the patient, yung tiyan niya, pwedeng nakakumot siya from waist down. Or kung ang i-examine mo lang naman, yung sa genital area lang. So, pwede mo i-cover yung ibang part. Just make sure to provide, draping sa kanila. And then, there's new methods of patient assistance. So, pwede mong gamitin yung kamay nila to guide your hand, things like that. And then, while doing the physical exam, you can ask them if they have questions for you. So, that will help them be at ease. So, before you start the exam, again, this is a breakdown, no? You check the nonverbals, try to be calm, be aware of the patient cues, you set the agenda. So before you start, just tell the patient that this tatagal lang to mga 5 minutes, ito yung mga i-check ko. Make it standard. Pwede niyo sabihin sa patient na this is something that we do for all patients. Yung chine-check kunwari yung anal area for some warts, so that they would feel na hindi lang sila yung ginagawa nun. You ask for their concerns and ask about comfort. So you can reassure them that anytime they want you to stop, titigil ka because you will be guided by your patient. So when you move from one physical exam to the other, you can always ask this, is it okay? Pwede bang gawin ko to? And also, it would be nice if that the patient has someone with him. So you can ask support from another person. So you can invite them in kung okay lang din sa patient or if they're with their partners. During the exam, so we discussed this a while ago, just there has to be draping. You introduce the examination components. You explain to them why you're doing it. Dapat nakikita ka nila. And always ask if they're comfortable. And use the professional touch. Tell them what to expect or what you're about to do and be very, very efficient. So when you're using the rather than your, makes your statement sound more professional. Okay, and less personal. So let's avoid saying your pants or your ganon. So you can use the. And after, you say thank you, and then you discuss the results or your findings. And again, ask them if they have questions. So you can tell them na, okay naman yung pakinig ko sa baga mo. I didn't see anything abnormal with your abdominal examination, because that reassures them and encourages them. So this, again, you can find dun sa website, it's a website, no, on what you are going to look for per system. And again, I mentioned a while ago, kahit while talking to the patient pa lang, you can observe them already without going to the physical exam part. So, hindi siya checklist na 1, 2, 3, 4, 5. No? Pwede siyang happening all at once while you're talking. You've inspected the skin while you're talking to the patient. You saw that if the patient has a disheveled appearance or payat na payat, parang nag-PPE ka na, kausap mo pa lang siya. Right. And then these are some of the laboratories that are suggested by the sa IDSA 2020. And our fellows in medical cities, Dr. Ko and Dr. Guzman, made this for us. So they summarized the labs needed for entry into care. So you can see the minimum requirements from the Philippine AO, what's suggested in the AIDS info and medical city. So yung CD4, sometimes a lot of people ask, kailangan ba talaga yung CD4 count? And then it's not really a requirement, but there's an advantage to doing it, especially if you think that your patient is very, very sick. Kasi there are some opportunistic infections that will require you to treat the opportunistic infection first before you start your ARV, kasi baka mag-iris yung patient. Yung tawag na immune reconstitution inflammatory syndrome. So kailangan maunang gamutin basically yung infection muna. So this is a poster that I made when I was a fellow in PGH. This is just an idea or a suggestion that I'm sharing to you. Doesn't have to be like this, but sometimes para hindi nyo makalimutan or so it will be standard, you can have something like this posted in your work area or a little note under yung sa glass sa desk nyo, so that you know what you're going to do. So kanya-kanyang style yan, but it gives you an idea on what to request and what to request when they follow up. Tapos nakasummarize na rin yung CD4 count sa baba and what prophylaxis they would be needed for what opportunistic infection. And you have to discuss a vaccination then. But yung ibang parts dito are used in the follow-up, so we'll be discussing that later. But it's nice to have something like this in your workspace. So na-mention ko kanina yung CD4 count. It's not really required for ARV initiation in the treat-all era for HIV. Kasi nga, we've shown studies a while ago that starting ARV immediately or upon diagnosis has benefit. But you would need the CD4 to determine if your patients would need prophy medication and would need certain screening for certain opportunistic infection. And I think this is really applicable pa sa Pilipinas because a lot of our patients would seek healthcare at the latter part of the disease. Ibig sabihin, may nararamdaman na sila, so most likely, they are at the later stage of the disease and most likely, mababa na yung CD4 count nila. Baka meron na silang mga opportunistic infection that you would need to treat first. And you would need to give them prophy. So this is in terms of timing of when to start HIV treatment with certain opportunistic infections. Konti lang naman that you need to think about. So for TB, PJP, crypto, and CM. So this is based on the Philippine CPG, and we looked at AIDS Info 2022. So for TB, any type of TB, they recommend that you start the treatment within 2 weeks after TB treatment. For PJP, within 2 weeks of diagnosis, yan yung pneumocystis jirovecii pneumonia. For cryptococcal meningitis, it is recommended that you delay your antiretroviral treatment for at least 5 weeks or initiate your ART after 4 to 6 weeks of treatment for the cryptococcal meningitis. For CMV, so this is, you start your treatment at least after 2 to 3 weeks after CMV treatment. So how will you have a clue, aside from the CD4 count, na baka merong ganitong opportunistic infection yung patient nyo? Kunwari, the patient still does not have the result of the CD4 count and you requested for it because you're suspecting na baka may OI. CMV, so papasok dyan yung review of systems. So CMV, sometimes they would report seeing floaters or progressively nalalabo yung mata, cryptococcal meningitis, worse, severe headache, nagsusuka, signs sa mataas yung pressure or talagang masakit yung ulo, yung PJP, hingal na hingal, no? Nahihirapang huminga over a long period of time or parang progressive na mas hingal sila. And with TB, it depends on the kind of TB. Kung pulmonary tuberculosis, namamayat, nilalagnat, inuubo, kung TB sa utak, CNS TB, pwede yun, masakit ang ulo, so things like that. So you will have an idea if you're suspecting already na baka meron sila. If you have an idea, you can opt to refer or manage it. So after the physical exam and knowing that if you can start, you form the assessment and plan. So you determine the clinical stage of your patient, and then if there's an opportunistic infection, you diagnose it and treat it, and you'll be able to assess the need for prophylaxis, and you determine on that first visit, pwede na ba mag-ARV or mag-antiretroviral therapy? So this would include the patient's readiness. And this is important. Baka mamaya for you, pwede na, but the patient is really hesitant. So if you see or the patient really expresses, despite all your convincing na sinabi niya na ayaw pa niya or he's not ready, then it's not advisable to start treatment because most likely your patient will not adhere to treatment. So again, you identify the need for specialty referral. Know when to refer. So that's very important. Hindi mo kakanyahin lahat if you think it's a difficult case or if you think that it's really advanced AIDS and ang dami-daming infection, overwhelming infection. You can ask for help because caring for an HIV patient is a multidisciplinary practice talaga. If your patient is having visual symptoms, you call in an ophtha. Headaches, you can call in your neuro. Pag you feel like, you trust your gut. If you feel like it's not normal or there's something amiss, then you call your specialist. And again, in the plan, you discuss vaccinations again so that they know what to expect. And you provide a follow-up schedule. You can emphasize to the patient there's a need for close monitoring. And it would be nice if you can provide a helpline. Kasi minsan during the visit, wala silang matanong eh. But when they go home, marami silang may isip. So it's nice if you have a helpline. With me, yung style ko, I have a Viber number that's parang the one that I give to patients. Not my personal number. But that Viber number is with my secretary. And I tell my patient, you can reach this number during office hours. And the secretary will be able to forward the message to me. So things like that. Something or a number that they can reach out to. And then we also have sa hub namin, nurses that they can reach out to. And our fellows also have a phone kung saan sila pwedeng magtanong or tumawag. So basically, ang dami nilang pwedeng tawagan at puntahan when they need help. And that's gonna help keep your patients into the loop of care. So here are the available antiretrovirals in the Philippines. I think this will be discussed in a different session. So when you initiate your antiretroviral, you have to be able to monitor and discuss about treatment response. So you should be able to be prepared to answer commonly asked questions regarding ART. You explain what could be expected. So for example, before yung efavirenz-based treatment, sasabihin niyo sa kanila bakit mas sa gabi siya iniinom kasi baka mahilo ka or you might experience this, or you have vivid dreams, and if you do, if you can reach out to us if you need help. So you can advise your patient like that. And then how to take the ART, the timing of ART intake. Yan, papasok doon yung pwede bang kumain before mag-ART, pwede bang uminom ng ganito, pwede bang isabay sa ganitong gamot. So you have to double check. So merong mga app na drug-drug interaction. So you can check those kung pwedeng isabay. No? You can check for the timing. And then emphasize again the need for follow-up and monitoring. So when you discuss positive treatment response, you see clinical improvement, and then you tell the patient that you'll have this overall sense of well-being, pwede mag-improve yung gana sa pagkain, you'll have weight gain, the infections would usually resolve, and basically the goal is viral suppression, so you can check this after 3 to 6 months of treatment. So let's have a case. Pwede bang mag-ask ng 1 to 2 volunteers just to give us a plan for the case. So short lang naman. So this is a case of AP. He's 28 years old. He came in the clinic and his complaint was progressive vision loss. So it was a 2-year history of progressive vision loss. The left eye more than the right eye. Hindi siya nagpa-consult. And then 2 months prior, he noted that he's weaker, is losing weight unintentionally, and he would frequently get sick. Parang mayat-maya, may ubo, may sipon. He was attributing this to his mild COVID-19 infection, and he did not seek any medical consult after. So he thought that the weakness was a long COVID effect, parang nag-long haul siya. 1 month prior, he consulted again with an ophthalmologist, and they assessed him to have retinopathy that was likely infectious in origin. So he was advised to be screened for HIV, and the screening test turned out to be reactive. So while waiting for this confirmatory test, that's when he decided to consult at the ID clinic. So this is the past medical history of AP. So he had COVID-19 around September 2021. He has had several episodes of STDs for which he would be treated with unrecalled antibiotics and some intramuscular antibiotic injection that we cannot recall. So it would usually present as a penile discharge. He also underwent endoscopy and colonoscopy in July 2022 when he was being worked up for the weakness, and he reported at the time that he has melena, para medyo maitim na talaga yung stools niya. For his vaccination history, the only vaccine he has is the COVID-19 primary series, and he had Pfizer. So he used to be an English teacher, and then he transferred to the BPO industry. He disclosed that he was raped. He had approximately 10 years ago. He is sexually active since 2 years ago, occasionally unprotective, and usually he is the receptive in anal intercourse. He had approximately more than 10 casual male sexual partners, and currently he has a male partner who they have been dating exclusively, who is also a person living with HIV but with an undetectable viral load already. So medyo complicated yung history. So when I saw him at the clinic, he was weak-looking. He had very poor eye contact. Ayaw niya tumingin. He was just slouched at the side of the clinic. His vital signs were within normal limits. He did not have fever. He's 48 kilograms. Pertinent. So he doesn't have any thrush. No abnormal oral exam finding. His eyes had no abnormalities on the external examination. Febrile conjunctiva, sclery was anesthetic. but you can see his skin had scaly patches and hyperpigmentation and reddish part on the skin and dandruff. He had no murmurs, no palpable lymphadenopathies, no penile discharge or lesions, and no anal warts, and he had a tattoo on the left anterior thigh. So can we have someone to come up with a problem list or a plan for this patient? Kahit plan lang. Morning.
So
Thank you
parang
for
medyo
thank you for being victimized. Sige, can you come up with a plan or problem list with the patient? So if you saw this patient at the clinic, ano yung gagawin mo and what's your plan for the patient?
Since based doc dun sa history, medyo extensive naman na. So parang kagaya nga nung una doc, siguro given naman na na-establish na siguro yung rapport with the patient and then all that, na physical exam na din, we would advise the patient na since nakalagay naman po dun sa personal and social history niya ata and the sexual history na may partner din sa HIV. So most likely yung knowledge niya about HIV is also wide na rin. So may idea na rin siya. So it's not difficult to introduce the topic. And then given na reactive na rin po siya, di ba doc, sa screening. So first plan is to advise for or help the patient get a confirmatory test.
Okay.
And then yung workup po niya for blood workup gaya ng mga CD4 count kung kaya, and then also advise to initiate treatment.
So Doc JC, so your plan is to wait for the confirmatory test, do some laboratory workup, and initiate treatment or plan for initiation of treatment.
Yes po, Doc.
Okay. And then when do you think you need to see the patient again? Kailan mo siya papabalikin sa'yo?
Usually, Doc, for cases like this, kasi mukhang meron na po talagang opportunistic infection. So, as soon as the results comes in, and then para ma-initiate na rin, Doc, yung antibiotic na therapy if ever for opportunistic infection.
Okay. All right. Thank you. Thank you, JC. So I'll show what happened after. Let's see. Okay. So tama si JC, we did baseline laboratory test, but since naka-raise yung hand ni Madonna. Okay.
Hello, Doktora. Magandang
Hi,
araw
Madonna.
po.
Good morning.
Yes. Doktora, i-share ko lang. Ito lang yung thought ko. Kasi ako FAMED. So, probably, pag ganyan ang case ng patient, I'll refer it to infectious. But given the halimbawa, talagang hindi kaya ng patient magpunta sa infectious. So, kailangan i-try talagang i-manage. So, tingin ko, Doktora, given doon sa, is mag-concentrate doon sa, probably I consider CMV retinitis.
Mm-hmm.
Tapos, yung baseline laboratory, syempre, itetest na po yung baseline. Tapos, doon po magko-concentrate sa CMV retinitis. And parang after sabi niyo, Doktora, is kailangan i-treat muna siya doon before going to ART.
Yes.
So,
okay.
Probably, Doktora, doon. Kasi negative naman yung kanyang sa TB. So, hindi man magko-consider yung TB. Wala namang difficulty of breathing. Probably yung retinitis. Ayan, Doktora.
All right. Thank you, Dr. Yeah, thank you. Thank you for that, Dr. Swan. So, this is what we did, no? We took, syempre, baseline laboratory test. And I'm already an ID, but I'm not a retina specialist. I can only do so much. Para hanggang fundoscopy nga lang ako, hindi pa ako magaling talaga. So, to be sure, I worked with an ophthalmologist, parang partner ko na siya. Nasanay na rin siyang tumingin ng mga HIV patients. Kasi sometimes it depends on the skill also of the one who's going to look. So if you can find someone to partner with you, that would be great. Kung hindi naman, that's okay. So we referred him to Opta sa retina specialist. And then we provided counseling. And then I advised him to follow up ASAP. Actually, ASAP yung advice. Once with the lab test result and once he was evaluated by the Opta. Yung advice ko. But before he left the clinic or when he went to the clinic, when he left the clinic, I already messaged the ophthalmologist to expect this patient. Meron akong letter sa kanya, this is what we're looking for. Para even if hindi pa bumabalik yung patient sa'yo, the Opta will be able to communicate with you already. So yun nangyari, the patient went to the ophthalmologist. So kahit nung hindi pa siya bumabalik, alam ko na yung result ng Opta examination sa kanya. So kinulit siya ng secretary ko na mag-follow up, sabi, please go back to the clinic. So that's the nice thing about having a parang this helpline or lifeline. And I think what I want to emphasize here also is the communication between doctors. So you are the primary doctor of the patient. If you're going to refer the patient to others, it would be nice if you can reach out to this doctor para you can come up with a cohesive plan for the patient. Kasi minsan kawawa yung patient pagka siya pa yung nagta-translate nung sinabi nung isang doktor dun sa isang doktor, no? Tapos palipat-lipat siya. So it's good if you are able to communicate with the team. Okay, so these are my references. And so we'll continue the case of AP later, kung ano ba nangyari kay AP. Okay. Brad, are we having a break muna? Or do I continue?
Okay. Good